Are you familiar with your body? Do not scroll, please. I want to talk about breast self-examination, so it's very important you listen to me, whether you are a man or a woman. My name is Mercy. I am a registered nurse. I am currently practicing in the UK. Okay. Do I have a niche? No, not really. But I do everything nursing, every nursing content I want to do it. I'm into it. Count me in. Relocation packages, health talks, and everything. Okay, so today I will be talking about breast self-examination. What is breast self-examination? Simply put, it is a process of virtually and manually checking out the breast. It's a process of virtually and manually examining the breasts. Okay. Virtually and manually, because you can see what you're doing and because you're using your hands to feel what you're doing. So that's why I said virtually and manually. So, like I said, we're talking about breast self-examination. So it's something you do on yourself. Whether you're a man or a woman, you just need to do this. For the ladies, it is advised, it is the best time to do your breast self-examination is about a week after your period ends. Now, what you want to do, I'm going to be showing you today, I'm going to be showing you today how to carry out a breast self-examination. Now, what you want to do, you need to go before a mirror, appear before a mirror. With your hands by your side, I'm not able to stand, pardon me today. So with your hands by your side, you need to look at your breasts. You know, when I started this video, I said, are you familiar with your body? This question is very important. Why? This is because if you are, or if you familiarize yourself with your body, you could always tell when there is a difference. You could always tell when there is an abnormality. I'm not talking about your husband or partner. I mean, you yourself, being familiar with your body, you would know, you'll be able to tell when there is an abnormality and you can take proper steps. Okay, now back to what I was saying. You stand before a mirror and observe your breast. You just look. So the first step in breast self-examination is look. So what are you looking out for? You're looking out to detect any swelling. Is there any redness in the breast? Is there any discharge in the breasts? Any blood coming out from the breast? Is one breast lower than the other? You know, sometimes it can be the case for most people, and that's normal. But when there's a very obvious difference, okay, then there's a problem. Now that's what you do. With your hands by your side, you look at your reflection. Okay? Look to the mirror. After that, you take your hands up. Just like I'm showing you now. You take your hands up, and then you are as well looking. So with looking, there are two steps involved with looking. With your hands by your side and your hands raised up. When your hands are raised, you can see further if there's anything you did not see when your hands were by your side. Okay. Now the next step is feel this. Your middle fingers, the 3 middle fingers, you use this to feel the breast. Now, what do you do? When is the best time? I've said that, yeah. Okay, it is best to do this when you are in the shower or when you are lying down because it gives you room. You are able to do what you want to do. You know, it gives you room. You're able to feel all the corners and everything you need to do, yeah? So, I'm not able to lie down and I'm not able to go into the shower now to show this to you. But I'm sure you can understand me because I'm taking my time to explain this. Now, it is best, like I said, it is best to be done in the shower or when lying down. Now, what are the ways? You can take it in a circular motion or you can take it up and down. Okay? Now I'm going to show you. What are the things you are looking out for while carrying out the breast examination, while feeling the breast? You're checking for any abnormal swelling, okay, any lump in the breast. You're feeling the breast. That is why it is important to familiarize yourself with your body, because if you know how your breast feels and look, you would know when there is an abnormality. Now, what you want to do, of course, most people recommend that side of the breast you want to examine, you take your hands, like for instance, you want to examine the right side of the breast. You take your hands under your head, okay, at the back of your head, and you do this examination. Now, I'm going to drop this mic so I can do this, so you can see what I do. Here we go. So, your hands this way. With your 3 fingers, that is what is recommended, but you can do what's best for you, really. You can do this. So, you do this in a circular motion. You could do the stroke type, the up and down movement, but you could start from the armpit, from the tail of Spencer, just at the tip of the breast here in the armpit. You press it hard to feel for any lump. That is especially what you're looking out for. So you go this way, from the armpit, you go down to the breast, and then feel it. Just around, circular motion. Do this. Okay? You press and check. You see what I'm doing? I'm pressing firmly up here. Firmly, firmly, firmly. There you go there. You can give it a soft touch here. Go on then. So what do you get? So what I mean is interchangeably. The pressure should be, you should interchange the pressure. So you can go soft and you can go hard. There's some areas you need to go soft and there's some areas you need to go hard. So now you do this around till you get to the nipple. You also examine the nipple to feel for any lump or any swelling. Okay. Now, you can also take up and down motion and you do this. So don't forget your armpit is very important to get to that point or to start from there, and also your collarbone. So you're also checking down, down. It can be painful, especially for young growing adults. So you do this. Just like that. Okay? And then you can take your time to examine. Okay? You do the same for the other hand. You do the same thing, just repeat the whole process over here. And that is done for you. Now, like I said earlier, things to note. Dimpling of the breast. Does your breast look like an orange peel? Is there any unusual swelling in the breast? Is there any discoloration or redness of the breast? Is there pain in the breast? Is there any discharge or bleeding from the breast? Is one breast far lower than the other? Is there a wrinkling of the breast? These are the things you should take note of. And if you notice any of these signs, what do? Please go to the hospital and get checked. Remember, breast self-examination is one of the major ways of preventing breast cancer, okay? Or it is also used for early detection of breast cancer. Thank you for listening. Please subscribe to my channel. Please subscribe to my YouTube channel, and you can follow me on all my pages. I'm Mercy Eko on Facebook. I am Your Favorite Nurse 17 on Instagram and also on TikTok. Thank you for listening. Bye for now.